if clinicians hear that you're doing this for performance monitoring, it sets a totally different lens on the demand characteristics of what we're hoping to see over time. We're then hoping to see improvements over time in a steady rate versus when we're doing measurement-based care for clinical practice, we are first of all able to individualize our measures much more because it doesn't matter how many other clients in the system have the measure that we're selecting. So that gives me as a clinician a lot more flexibility. And also we're able to explore and normalize with them the ups and downs that can happen throughout treatment and not worry so much about the quote validity, external validity of the score, but rather using it as a conversation springboard. So there's another layer of pressure on the clinicians and on the patients. If you are aggregating these data, you want to be super transparent to the clinicians and clients that that's one of the ways that your clinic is using the information. And there's a whole set of cautions around that. I'm going to drop a publication in the chat, which is open access, which talks a little bit about considerations for aggregating up because you do want to be a little cautious.
In terms of selling this to clinicians, you want them to see the value. You absolutely want them to see the value in this. And so if they think that they're doing this as a performance measure or to evaluate something, that's not going to necessarily directly immediately benefit the client that is sitting in front of them. So when you think about all of your implementation strategies, what I always keep in mind is what's the value to the client, and what's the value to the provider? What is the provider getting out of it?